Hello, Herb Silver here again, talking in the Breathing is the Key lecture series. I want to talk a little bit or introduce the concept of over-breathing or review it for those who've already listened to some discussion of over-breathing. The term has to do with uh, breathing off too much carbon dioxide, and we get to do that by if we breathe through our mouth or breathe too rapidly or chest breathe or breathe with a slumped posture and don't allow our lungs to be fully ventilated. Technically, the overbreathing is when our carbon dioxide levels drop too low, and you can review our talk on oxygen dissociation curves and how the acidity of your blood in combination with carbon dioxide dictates how well oxygen is disassociated from the red blood cell hemoglobin and it's then able to enter into the muscle and brain and other organs. So this is the issue, is that if we overbreathe, blowing off too much carbon dioxide, the carbon dioxide levels in our blood actually drop, alkalizing our blood, making the oxygen stick to the red blood cell. And even though our blood is fully oxygenated, as we can see with an oxygen saturation pulse oximeter, even though our blood's fully oxygenated, that oxygen isn't getting into the muscles where we have trigger points, and it isn't getting into our brain where that's creating issues with anxiety, depression, etc. So I want to share with you just a list of things so you'll understand why this is so important. I want to share with you a list of symptoms associated with hypocapnia. So here we have, wrong share. Let me stop that. Let me share my screen. Here we go. Here is a list of all the things that are associated with hypocapnia. And the things I like to point out, asthma, COPD, that kind of thing. Brain fog. How many of us see people with brain fog? Chronic coughs, constipation, depression, anxiety should have been in there. Dizziness, of course, we see a lot with in our balance and dizziness clinics. Heartburn. A lot of my patients are on proton pump inhibitors. High and low blood pressure, muscle cramps, muscle pain, myofascial pain, osteoporosis. How many of you see these kinds of things in your clinics? Snoring, sleep apnea, TMJ problems. So there you have, just a summary of all the things that are influenced and can be induced by overbreathing intentionally. You can make yourself anxious and put yourself in a panic attack by breathing off CO2. You can change your blood pressure. I've changed people's blood pressure in clinic in minutes. Blood pressure drops. Never tried to raise someone's blood pressure, but they were already doing it themselves by overbreathing, and that's how we're reversing the process and dropping their blood pressure, heart rate, resting heart rate drops, etc., as does tenderness in myofascial trigger points. So it all fits together, and that's why we want to discuss this issue with overbreathing and teach ourselves and our clients how we can regulate carbon dioxide levels in our blood so that oxygen more freely disassociates. So if you want to review that oxygen dissociation curve to be more clear on why that isn't happening and how to make it happen, please review that lecture. If that's clear to you, then you can move on through our lecture series. And thank you for your time.